Good afternoon, wherever you happen to be in the United States. Welcome back to the Amputee Coalition's Virtual Advocacy Forum. For those of you who weren't here this afternoon or yesterday, I'm Carol Blymeyer, and I'll help host our conversations here today as part of the Advocacy Forum. Before we get started, just a quick reminder, we are recording these sessions and they will be sent to you via email for rewatching. Also part of the recording is the chat. So the chat will go into an archive as well, so you'll be able to refer to that later. We ask that you conduct yourself in the chat as you would on any social media platform. Be kind and respectful of one another, have some fun, engaging conversations, and just be mindful about the kinds of personal information that you might share there. If you have a question at all for any of our presenters today, please type it into the Q&A box on the right side of your screen. On that side of your screen, you will see prompts for the chat, the Q&A, polls, and handouts. The handouts have a lot of great information that will provide background details for you about all the issues that we're talking about and some of the words that we're using. And so that's where you'll be able to find that. But if you have questions for me or for any of our experts today, please type those into the Q&A box so we can make sure that we get those asked as part of the conversation. So let's talk about who's joining us today. First, from the Amputee Coalition, we have Mary Richards, who is the president and CEO. We also have Dan Ignazewski, who is the Amputee Coalition's Chief Policy and Programs Officer. So now I'm going to turn it over to the CEO of the Amputee Coalition, Mary Richards, who will tell us what we have in store for this session. Go ahead, Mary.
So we're hosting this advocacy forum because the coalition's mission is to reach out to and empower people affected by limb loss to achieve their full potential through education, support, and advocacy, and to promote limb loss prevention. We have unparalleled education and support programs, and we are working to elevate advocacy as a priority. Here are the goals for this afternoon sessions. This afternoon, we will learn about the current political landscape on Capitol Hill, opportunities to make a difference on our issues, and on the Amputee Coalition's 2020 policy requests. I'm a deep believer in grassroots advocacy. You are the experts on living with limb loss and limb difference. Today, you'll learn how to bring your insights, expertise, and personal experience to the legislative process. And we're looking forward to doing that alongside you. With that, I'll hand it back to Carol to get us started with our first poll.
Thank you, Mary. So in just a moment, a poll question is going to pop up on your computer screen. All you have to do is click an answer. There it is. So our question is, with COVID-19, what issue is most on your mind? So it looks like right now, the majority of our respondents are really concerned about social isolation, and we understand that. So right now, about half of you are most concerned about social isolation when it comes to COVID. Then we've got another 40%-ish concerned about their prosthetic care. About 10%, 15% are worried about access to telehealth. And then only 3% of you are worried about transportation. Really, really interesting results. When we do these polls, this information not only is interesting to you all to be able to see how you're responding and feeling and thinking in all different parts of the country, but this really helps inform the Amputee Coalition about how we can fine-tune and take a look at the services and supports that we offer and help stretch those out a little bit more to make sure that we're being of best service to you. So no matter what the issue is that we talked about in this poll, whether it's telehealth, prosthetic care, social isolation, COVID-19 affects everyone. It affects how we live, how we work, and it also includes how Congress works. And some of you might be wondering, isn't Congress busy with COVID-19? Should we really be reaching out to them with other things about our community? So Ray's going to talk about how congressional staff is working hard on a lot of things in addition to COVID-19, like the federal budget for the new fiscal year, and how they want to hear from you about what you, as their constituent, might need. So to talk about how COVID-19 is reshaping the political landscape on Capitol Hill and what it means for all of us, let's welcome Rae Downs. Rae has worked on health policy in the U.S. Senate. She's also worked on health policy at the Department of Health and Human Services, and she's a founding partner of her firm, Tarplin, Downs, and Young. So Rae, welcome to our Advocacy Forum, and we're excited to hear from you now.
That was a fantastic and very lovely introduction. And Carol and Dan and Mary, thank you for having me join today. This is a real privilege and an honor, frankly, to be a part of this conversation. And I think there's lots and lots of opportunity to make progress today with respect to helping understand and redefine the landscape, and then have very effective advocacy with that backdrop in mind. So I'm really, really privileged to be here, and just would say very quickly to everybody on the receiving end of this virtual forum, I too wish we could be in person. It would be a phenomenal experience to see everybody and meet everybody, but you should know that you are in tremendously capable, trusted hands on the team that you have on the panel with me today. These folks are the best in the business. They have been devoted here in Washington doing work on your behalf, and the respect and the relationships that they have developed over many years of being very credible professionals serves you better than you could ever be served. So I really want to let you know that you have first-in-class folks working on your behalf here in Washington. And I'm privileged, again, to be a part of the conversation today. So thank you all so much for having me. I think, as Carol said, the transition that we are all experiencing at home with respect to dealing with and adjusting to living with the pandemic is also being experienced here in Washington. And frankly, we started, I would say, really last summer, last fall, with a 24/7 onslaught of the fact that 2020 is a significant election year. So election years always carry with them sort of a shift, sometimes tectonic, frankly, in the underlying political landscape and legislative landscape. So we had that to begin with, and I think tectonic is probably an appropriate word to use when we're talking about a potential reelection for President Trump, but also an unprecedented political primary season for Democrats. They haven't experienced that in quite some time. So that was again, 24/7 news. You could not escape it, even if you wanted to. So enter, the beginning of this year. The Democratic primary, again, was a real focus. They were winnowing down, but had not yet gotten to the point where Joe Biden is now obviously the presumptive nominee, not officially yet until the convention, whatever that might look like this summer, occurs. But then the pandemic hit, and that has completely displaced the front pages, that has completely displaced, frankly, the focus, both from a political perspective, but also from a Washington operations and sort of government as usual perspective. So I think for us, it is important to really talk about what does this landscape now look like as a consequence of this. So one, I guess, just important to flag, again, Joe Biden is now the presumptive nominee. So I think when we think about how our Republicans and Democrats, partisanship is a reality, so we do have to sometimes use that as a filter. How are they looking at the future? How are they looking at legislation? How are they looking at framing and reacting to the pandemic, both for political purposes, but also, very importantly, for our conversation, constituent purposes? It's different, right? I mean, I think Democrats continue to propose fairly significant funding packages, rescue packages. Ultimately, I think we will see a stimulus package. And at the end of the day, that means an enormous amount of new federal money. One is adding to the debt, but two is going into the system and the economy. So that is something that I think we, and Dan in particular, has been very attuned to relative to the impact on our community. I think from a Republican perspective, they continue to hand-wring a little bit on the Hill about pretty significant spending that is begun, but certainly is not ending. I think we, have just passed, they call it 3.5, but sort of a new half package last week that added another $500 billion to spending relative to responding to the pandemic, but there is significant anticipation of another very large package that includes both spending and policy to address the pandemic. And that could be another upwards of $2 trillion, if not more. Some of that will also include potentially infrastructure spending, so that will help hopefully revive the economy based on the devastation of the pandemic that we're still experiencing. So those are the sorts of things that have really refocused the attention, the time, and the resources of both parties coming at it a little bit differently. But at the end of the day, these will end up being, as they have been and will continue to be, ultimately bipartisan pieces of legislation that do get enacted. And a lot of spending is taking place and a lot of rethinking about the healthcare system and how to maintain access for people who are at risk and vulnerable or who are regular users of the healthcare system. And in some cases, some of us may constitute all three of those categories. So really important to make sure that as they are making accommodations, considering populations, that we are continue to be a part of that conversation, as we have been in these first few packages, particularly relative to access to telehealth services. So that COVID has blotted out the sun, right, from a political and a legislative and a policy perspective. There's no question about that. And I think what we really need to keep in mind is it is something that is going to continue to dominate the legislative process. But to Carol and Mary's very good points, the notion that being connected to your constituency in some ways is actually more acute for politicians right now, because they are so attuned to the impact of this situation on their state or their district. It is also an opportunity for them to be really connected with folks back home. And so, as Carol said, it's not that we cannot be talking to them about other things that impact us, but I think to the extent that we can connect it or present it through the lens of the impact on our community relative to the pandemic, that will be a really important variable. It's sort of knowing our audience, if you will. The other thing I would say is the connection to people, both elected officials and their staff, who are really important to all of these engagements, is different now, right? We're not in person, they're not in person. Their ability to do their job, it's not telling a secret out of school to say that Congress is a little bit of a dinosaur, right? They don't operate the way the modern economy and workplace does. Everything is very in-person. The buildings are old, the infrastructure is old, the technology is old. Most of these members are old, and so their ability to communicate is not what the millennial generation views of as communication. And so this has been a real challenge for them. So I do think that the grassroots, pure, genuine engagement that you will be bringing to them will break through and be really appreciated as they are all working remotely right now and trying to even understand how they can talk to each other, let alone stay in touch with their staff, and then obviously advocate through the legislative process. So for us, I think the political landscape has changed, but it's something that we can adapt to. And this advocacy forum is a really good example of how we are already adapting to what will at least be the new normal for some period of time. I think we've obviously talked about COVID and the fact that this is a lens through which everything will be viewed and processed and frankly prioritized. And I think we're well positioned to have ongoing good discussions that both, for lack of a better term, brand us as a community and our issues, but also allow us to be a part of and see constructive progress through conversations related to COVID. And then I would say that the one thing that, to Carol's point, we need to make sure we continue to stay engaged with them on our short, medium, and long-term goals as a community. They have created a couple of opportunities for legislating beyond COVID. Now, it's a ways off, and we'll see how it looks when we get closer to that. But there was anticipated to be, before the pandemic, a fairly significant healthcare bill that was going to move in May. We had been brainstorming and strategizing with our champions on the Hill, but also amongst ourselves about different policy ideas that we could, again, be putting in place and planting seeds for to advance our cause. Dan will talk a little bit more about that later. But that moment in time of a big healthcare bill, which was supposed to happen at the end of May, they have postponed that conversation until the end of November, which is post-election. So that brings with it both challenges and opportunities, but it is also an opportunity that we can begin planning for relative to our non-COVID agenda, which is still very important. So I think we have multiple opportunities, again, through this ongoing different but still ongoing exercise related to the pandemic, whether it is healthcare specific or whether it is infrastructure / stimulus specific in terms of moving forward. And then when we get to November, we'll have a health policy conversation that we can also be a part of. The other thing I would say is, the underlying appropriations process, which is the annual funding for the government that happens no matter what, has been overshadowed, obviously, under the circumstances, but it is still a process that will move forward. And the interesting thing is, we're very engaged. Dan is a well-known quantity with the Appropriations Committee, has had wild success in making sure that there is a consistent available funding stream associated with the work that this organization is doing. We continue to get very positive feedback that will be retained. As we move forward with this appropriations process. Again, it will be less visible because there's so much other front page news taking place, but our understanding from talking to folks, based on the good work Dan has done, is that the funding for the Limb Loss Resource Center, which is a big part of how we work with and serve you as a community, is embedded in the funding bill. That process will move forward so that funding will not be interrupted at the end of September when the fiscal year traditionally ends. Exactly how they move forward beyond that is unclear, but I think we have been assured that funding will continue probably for another short-term period of time before they do final legislation on the appropriations front. But there have been fantastic conversations, and I think to the credit of the team, there is a real commitment to making sure that the funding stream that we find very, very important to do our work will continue unabated, even with the pandemic situation taking place. So I would say, a couple of just very granular, maybe practical tips that I would offer up in this unusual time relative to circumstances and engaging offices and members. A lot of members have tried to be more virtual, more social media, more communications oriented, given the fact that that traditional way of doing business is not available to them right now in terms of dealing with constituents. A lot of them have daily, weekly, monthly newsletters that they are putting out to keep people apprised of what's going on. A lot are trying to do virtual town halls. Members are doing specific one-off engagements with different communities. Again, all of this is virtual, but it's a really interesting opportunity to access folks. So I would say, as you think about your advocacy work, as you are in touch with people you already have established relationships with, make sure a couple things. One, we thank them, for continuing in their public service. I know we don't always agree with their decisions or their votes, but we owe them a debt of thanks for continuing in their public service during this very challenging time. Thank them for continuing to be accessible to us. Hope that we can be put into their loop of feedback if they have, regular email listservs that they are now all developing to stay in touch with people. We just want to be as connected as possible because it's all about maintaining that relationship and adapting our relationship with these folks to the mediums that we have available to us now. And then as things open up and as they become more accessible again, we will just seamlessly transition that virtual relationship back into the physical relationship. So just a couple of minor things that I have candidly picked up from offices as we talk to them during this strange time. They really do want to hear from real people back home. They really want to hear about what your issues and concerns are, but they also want to know, how are you connected to the pandemic and how can we help? And is what we are doing helping you manage through this pandemic? So with that, Carol and Mary, I'll stop for a moment and make sure if I have not covered anything you wanted me to cover, please let me know.
We are getting some great questions submitted. So we're going to open this up. So Mary and Dan and Ray will join us all on screen, and we're going to start answering some of your questions. The first question is, the government has been spending a lot of money on COVID-19. Can you tell me how that is different from regular government spending and the regular things that go through appropriations? How is it different from that? And then will they be merged for future budgets? So do we now have to compete with COVID for funding for next year? It's a great question.
A great question. That is a very, very sophisticated question. So, and I'm sure a lot of people have the same question. So the answer is they are separate funding streams. So the regular appropriations, which we have traditionally worked through, We'll continue on sort of as a parallel exercise, and the levels of funding under the regular appropriations are set based on budget caps on an annual basis. Sometimes they get set on a biannual basis, which they were for this year. So we're spending for what is now the FY 2021 bill. Those are the bills they're working on right now. That spending is set. There's a limit, which is essentially, again, an annual budget cap that Congress has to set every year or every couple of years, depending on how long the term of that agreement goes. The spending on COVID is all considered emergency or supplemental funding. So it is appropriated and then it's done. It runs out. And that's why we have seen them now do 3.5 bills, as we call it in Washington. Only in Washington can we make it more confusing. But the 3.5 bill we did last week, or Congress did last week, was pure spending. They spent another almost $500 billion, but that falls into the emergency column. So we're not going to be absorbing under the traditional regular order appropriations that, again, we depend on going forward. Once that emergency money is spent, it's spent, and it doesn't become part of the new baseline in the budget. What it does is add to the debt. So it doesn't go unaccounted for, but it doesn't count against future spending in the regular approps process.
That's great.
And Carol, I'd just add that the emergency spending that won't move forward into the new into a fiscal budget or an annual budget, there are a couple of things that have happened there that have been really helpful to our community. And then we'll continue to seek opportunities where we can to support the community's needs in those special appropriations opportunities. And so hearing back from the community, things like social isolation is the biggest challenge that our polls show that we're facing. That gives us a chance to talk to Congress and say, these are the things that are most concerning to us, and we could use some additional funding to address those needs.
We've got a really good question from an advocate up next. In the past, I have used the Amputee Coalition online forums to contact my senator and representative. Their response came several days later with a form letter. How can we use virtual visits to tell our story and make a specific ask? That's a great question. Oh, sorry, Mary.
No, please go ahead.
That is a great question. And I think, honestly, it is partly, frankly, tapping into what they are creating as opportunities to have a more real-time live but virtual connection. But the other is to separately engage at the staff team level, which again, it's we can't do this, everybody can't do it for all congressional offices because it loses its authenticity and its constituent feel. But I think if we have offices that are representing us based on where we live, we should absolutely take advantage of reaching out at the staff level the person who is assigned to manage issues that we care about, and make sure that we're establishing that relationship. And I understand they're overwhelmed too, so sometimes a form response is what you're going to get, and it isn't indicative of the fact that they're not interested. But I do think there's another level that we can bring to our advocacy work that is a direct engagement with individual specific staff folks.
I would just add, and then Dan, maybe you can talk about the CQ Engage effort that we'll be sharing with everybody later today or tomorrow. As a former staffer, when I would have to write form letters to respond to constituent needs, if you get a form letter that says, thank you for contacting me about living with limb loss, and then you've got some level of detail, not just thanks for reaching out, although those do indicate they are pulling that information, they're bringing it across the staff. But when you hit a certain threshold of emails that are related to the same topic, you then develop a form letter on that issue, which means it goes through the whole process. Most of the staff members have seen it. The member of Congress, the senator, has seen this. So they're taking a stand, they're telling you where they are on a topic. And I would just say that as we develop those personal relationships with the health legislative assistants, the caseworkers back in the district, you also kind of want to rise to the top. And there are times when I feel pretty accomplished that they had to write a form letter for us. So just take those wins as they come, and know that they've never received more communications than they are right now. So anytime it is a little bit more personal towards you, that is a huge win. And you've made that connection that I think will help us in the long run.
Yeah, and I would just add, we will have tools and resources for everybody in the community to be able to take action as a follow-up from this advocacy forum. So those letters, those opportunities to be able to engage with your members are going to be available to you. But part of the reason that we're having these sessions and getting you engaged to help understand the bigger political landscape, understand our specific requests, is so that we can follow that up with your story and your experiences and how they tie into some of those issues, so that we can help make it more personal and make it more relatable for members and their staffs to understand better. So when we have these opportunities to be able to engage with your members through our engagements that we're going to be setting out and that you're going to be able to take action on, there's going to be a section within that you can share your story. There's going to be sort of an introduction and a closing that's going to be kind of templated out and have some of the asks and some of the requests, so you don't have to know and memorize all of this. But there's going to be a section where you can explain your story, explain how the COVID-19 pandemic is affecting you, how access to care has become challenging, what types of experiences you are having as somebody who's living with limb loss or limb difference. And that's where, by telling your story and by engaging with members in that way, filling out that letter in a really personal way, sharing your personal story and experience is going to be really, really valuable for helping not just get those form letters, but really have that personal interaction with staff that we can help develop and build a relationship with.
Our next question is about how we frame what we're asking about, and I'm using the word frame, how we frame about what we're asking about with relation to COVID-19. So these asks that are going out to our advocates to be able to send to members of Congress tomorrow. Should we mention COVID-19? What are some of the do's and don'ts with talking about where we are currently?
Yeah, I would just say, I think sharing your story again. I think that how COVID-19 has impacted you is going to be really valuable. We saw in the poll earlier today that social isolation is a big challenge, that telehealth is a big challenge, that prosthetic care and getting access to appropriate prosthetic care is a challenge. That may be something that's specifically as a result of the COVID-19 pandemic. There may be exacerbating challenges because of the COVID-19 pandemic, or it may be something that may have been around or maybe existing before the pandemic started. But all of those are going to be relatable and need to be elevated to members, because the truth is unless they hear from you and they understand how these issues are impacting you as an individual and as a constituent, they're not going to be aware of them. And so a lot of this is raising awareness and educating members to help them understand what these issues are and how you can be helpful in elevating them so that we can bring forward policies that are going to impact people in a positive way.
And I would just add that if you've had a telehealth appointment yet, I've had one, and that has been new for you and went well. There's a lot that's going on, both with Congress as well as the administration, to open up things like telehealth appointments in physical therapy, wound care, and in other types of services that we need as a community. So if you've had a good experience with that, I think a thank you is always nice to hear when people are working kind of 14, 16-hour days. To hear that something that they've done has impacted you is going to be really nice for them to hear. And then we will give you in the templates that we provide a little bit of those connections so that, we're learning together over the next few days, but this is not a pop quiz situation, right? So we're going to help you shine and to be able to connect those dots as best that we can, and then share with you things like this. So if you've had a telehealth appointment, if there are things that you have found that are particularly helpful to you or that you need, saying those things directly. These are human beings on the other end of the emails that you're sending. And so just connecting with them as people is going to be really helpful to all of us to make those connections so that they feel really great about helping us out.
And then there's a follow-up question that just came in. Dan, when you talked about raising awareness, this individual wants to know, where do we stand in terms of awareness of our issues and our policy agenda with leadership? And I'm assuming that is both House and Senate leadership, and then also the committee leadership of who makes the decisions on funding.
Yeah, absolutely. We've had some really positive conversations. Ray alluded to that earlier, and we've had some really positive conversations around the appropriations side, around some of the health pieces, and especially around some of the COVID response. Ray, do you want to touch on some of the things that we've been in touch with members?
Yeah, absolutely, and it really is a testament again that there's a level of awareness, there's a level of understanding to try to accommodate our community as folks grapple with the pandemic response. So, I mean, I think telehealth has been a significant part of that conversation, and I think for us, it's an interesting and unique, frankly, need. I mean, the poll, it was interesting that was not high on the issue list, and I'm hoping that's because it has been something that has been easily accommodated for folks, and so it was lower down on the level of concern. But I think it's an area where just maybe 10 seconds of sort of background, pulling the lens back a bit, telehealth has been largely resisted by Washington. For many years, there has been a push, whether it's because of rural community, lack of provider access, whether it's because of, urban core communities that also lack provider access. Telehealth has been an alternative that, frankly, the technology has existed to in a very safe and effective way deliver certain health services through telehealth. But again, the government is a little bit outdated in how they think of things and how they manage. So they have been forced to really embrace telehealth in response to this, pandemic. And as a community, they have made sure that we have been accommodated through everything from phone-only visits relative to people's access to more sophisticated technology, to making sure that the range of providers outside of a physician are able to be in communication with patients. And I think it's an ongoing conversation actually that we are having with CMS, which manages the federal healthcare programs, about as we learn and live in real time with this experience, what more can we be contributing to that conversation. I think the other thing, candidly, is as a community, we are business owners, we're employees, we're individuals, and I think the voice of this community has been a part of advancing policies and, frankly, funding programs that are intended to make sure that individuals have a little bit of financial stability. It's not as good as it could be if the economy were roaring and we didn't have a pandemic, but I think we've also been a part of those conversations to make sure that individually targeted supports are also going to our community.
We are starting to now get a lot of questions about the specific asks that we're going to be making of Congress. So this is perfect timing to pivot to have Dan give us a little bit of background on the Amputee Coalition's policy requests. So Dan, why don't you take it from here and talk through what our big asks are for this year?
Yeah, absolutely. Thanks, Carol. Yeah, we really have tried to make sure that we are being responsive to pivoting in this environment and reflecting back the conversations with members of Congress, a tailored ask that will really help the community and help support how we're going to be able to move forward. We've really been thoughtful in the approach this year. And so given where we're at with everything, we've kind of narrowed it down to two main policy requests. The first, many of you are probably familiar with. We've had it for the past several years, but the first is around appropriations and funding to be able to support the National Limb Loss Resource Center. For fiscal year 2021, which is the appropriations that they are considering now, what we're asking for is for Congress to fund the National Limb Loss Resource Center at the FY 2020 level of $4 million. The truth is that funding helps to support many of the Amputee Coalition's programs, and it really helps to serve the community. With that funding, it goes to help support the Information Referral Center. It helps to fund and support the Certified Peer Visitor Program. Many of our training programs, including the Certified Peer Visitor Program, our Lead Advocate Program, many of our events, many of our publications, and a lot of the resource development and research priorities that we're trying to help support. So that funding is really, really essential and really important to helping move things forward. I also noticed in the chat a little bit earlier that, it sounds like people are really clamoring for these supports, whether it's the response in the poll with the social isolation being a challenge, or even some of the feedback of, figuring out how the Amputee Coalition can provide more virtual events, given the fact that, people can't travel as much right now. People aren't able to get into larger events and larger engagements with other community members. And so, what we want to really do is make sure that we're adapting as an organization and with that funding support to be able to help promote opportunities like this virtual advocacy forum for other ways that we can engage with folks so that they don't have to travel and so that they can be engaged during this ongoing crisis and as we're responding to that. So that's the first request that we have is to continue funding for the Limb Loss Resource Center. The second request we have is a little bit more unique, and it's something that will come along as Congress moves forward this year. But the second request is really for an access to care study that needs to be conducted. The truth is Ray mentioned that the package, the healthcare packages that were required to pass in May got shifted to November. And so we were really focused on elevating the broader access to care challenges that the community faces. And that includes some of the things around insurance fairness for amputees, but it also includes things like physical therapy and occupational visits. It includes some of the telehealth supports. It includes a number of different resources that are beyond the device supports and the prosthetic care alone to really encompass whole person care. And so what we're planning to do is, as part of the request that we're going to have everybody participate in, we've talked about the need to make sure that Congress is being responsive. And so, we're going to thank them for the engagements that they've had already with the community with the COVID-19 packages and supports. But we're also going to let them know that we're planning to come back to Congress later this year to ask them to study the barriers and challenges that our community is facing, and in terms of access and care and support that they need. Like I said, we've talked a lot about insurance fairness for amputees in the past, and that remains a top priority. But we're going to talk about it a little bit differently, especially given the current crisis and where things are going. But the core of it isn't going to change. The focus that we're going to have is we're going to be talking about access to care. And that was part of the Insurance Fairness for Amputees Act, but the insurance part of that is really only one way to get access to care. It's not the only one. So we're going to continue to develop the Insurance Fairness for Amputees Act. We're going to develop other legislation that's going to continue to evolve as we move through Congress this year. But we want to make sure that people are getting the care that they need and that the community is getting the supports that they need. So that's where we're going to be talking about this study that we're going to ask Congress for later this year. And that'll be part of the request. And I think layering that in and having that conversation now will really help the organization push that initiative forward and help advance access to care in a unique way and a really good opportunity come this fall as that package is required to be passing in the fall. So those are a couple things that we've got focused on. I know we're coming down to a handful of other things that we want to wrap up on now. But with that, I want to make sure I hand it back to Carol and make sure that we can have a little bit of a dialogue about some of these challenges and some of the issues that we just talked about or other issues that you might identify.
Mary back on screen, and let's have Ray join us too with Dan, and let's get to some of these questions that you all have been posting in the Q&A section of your dashboard. The first one is from an advocate named Anne, and she says, $4 million seems so small. How much is our current funding level?
So great question. Yeah. So the current funding level is $4 million. So that's what the organization's been funded at. Truthfully, the funding to support limb loss research and limb loss programs hasn't been proportionally the same as what it's been for other populations. And so
Oh, Dan.
I think
Dan's frozen. Go ahead, Mary, take it away.
So there are 2.1 million Americans living with limb loss and 28 million Americans who are at risk of losing a limb. We know that $4 million for the National Limb Loss Resource Center provides us with critical funding to provide services and programs that I hope that you are aware of and that you maybe are a part of or have taken advantage of, which is the whole reason why we have money and the reason why we are here is to help. But I also think that, to your point, $4 million doesn't seem like a lot in the scheme of things. There are some other buckets of dollars that are not dedicated specifically to addressing the needs of people with limb loss in the federal government. National Institutes of Health funds some research, the VA funds some research, and provides things like the clinical guidelines. But the National Limb Loss Resource Center is the only specific program for our community. And so that's where we're focusing this year. We would love to see increases beyond the $4 million. We've made some strategic choices this year to request the same funding as last year, which is $500,000 more than the previous year. So we'll stay at $4 million in our request this year. And our appropriations friends who are on the committee are aware that we are not seeking additional revenues, but are planning to make the best use of that $4 million. And we may be coming back to talk about how impactful that is, how the programs have reached more people, how we're serving the community, and then potentially to expand those dollars in the future.
We've got a question about Medicare. Does Medicare pay for telehealth with prosthetists?
So that is a great question. So I think the way you could read the flexibility that the government has been operating under, the answer should be yes. It's actually a timely question because we are expecting clarification from the Centers for Medicare and Medicaid Services, CMS, who oversees the Medicare program, probably in the next day or two. They have issued, candidly, on government time, they have been operating at light speed relative to producing guidance and addressing flexibilities in the programs. And that continues. The pace is relentless from their perspective based on how long it typically takes to alter a program or ease some of the restrictions in terms of access. So it has been read what they have issued so far in terms of telehealth flexibility, which again, is in place as long as the pandemic is ongoing. So this is part of what Dan and Mary have talked about. Can we see about extending some of these flexibilities related to telehealth going forward? Specific allowance for prosthetists. Again, we believe, as we read it, that is an allowable telehealth service that can be billed for under Medicare, but we are anticipating additional, hopefully, clarity coming from CMS with respect to the telehealth flexibilities this week. So that's something we can continue to update folks on as more details come forward.
And there are some challenges related to that too, just in terms of with prosthetists, there may be some things that they will be able to do in a telehealth visit, and those things we should explore that and kind of figure that out. The fitting of a prosthetic device, the fitting of the sockets, the things like that, those are really hands-on activities. That type of stuff may not be available in a telehealth setting anytime soon, but those are opportunities for us to be able to look at how can that look moving forward, how can we participate moving forward, and the profession, the O&P profession, orthotic and prosthetic profession, has been really responsive to that in a lot of ways.
Mm-hmm. Here's another question from an advocate. Does the organization lead or advocate on topics such as access to healthcare providers, insurance coverage, lifelong device care and replacement? And is there any approach in the state around Medicaid state plans and potential waivers to help amputees both directly and with peripheral issues? And then how can we help advocate for that?
Yeah, I think broadly, the access to care focus that we have, that covers a lot of those things. It covers the insurance access. It covers some of the areas around the devices, not just prosthetic devices, but also complex rehab technology, physical therapy and occupational visits, different things that you as an individual interact with the healthcare system on a regular basis. We want to make sure that you have access to the care that you need. And so that's going to be a top priority for us. A lot of the things that we do at the state level, we do with advocates like you. So if you want to get more involved in the states, we really need your support. We have the Lead Advocate program. We developed the Lead Advocate program to help efforts in the state as well as at the federal level. When states are looking to expand Medicaid or make revisions to Medicaid policies, or even the essential health benefits in some of the states. Those are all ongoing activities that are happening right now. And they're going to continue to be activities that happen on an annual basis. And so your involvement as advocates is going to be essential to that. Helping raise awareness with the Amputee Coalition of what's happening in your states is going to be essential to that. And those are things that we do get involved in and want to support to make sure that we're expanding that access. But we also need advocates like you to help bring that to our attention and really help lead the efforts in your states. So plug for the lead advocate program. If you're interested, make sure to reach out to us and let us know, because that's a great opportunity for you to engage with us on some of those state issues.
Okay, our next question is regarding the Insurance Fairness for Prosthetics initiative at the federal level. Where does that fall in the Amputee Coalition's policy agenda?
So really succinctly, that is part and parcel of what we're working on for this package that may move forward in November, that has to move forward in November. So insurance fairness as its own standalone legislation is something that is in the policy development side of our government relations shop, as it were. But the study related to access to needed care, including prosthetic care, is embedded in our activities that we're working on towards that package that has to move in November. So we are using different language, but the intention is the same. Insurance is the mechanism by which people get access to needed care. And some people have private insurance, some people are on the exchange or using state-based insurance plans. Some people are on Medicaid and some people are on Medicare. So there's all sorts of ways of dealing with coverage. But what we are trying to do is break down the barriers to getting the care that you need, irrespective of the mechanism of getting that care.
Okay, the next question is, how many states are we up to with the Insurance Fairness for Amputees Act?
Great question. So we've got 21 states that have passed the legislation. So we've got 21 states with laws that are in place. We've got a few of those states that are looking to amend those laws. But then we're also active in a number of other states that are actively looking to advance legislation this year and in future years. The COVID response has delayed some of those efforts and made some of those efforts a little bit more challenging. And state sessions, a lot of state sessions are only open for the first half of the year or so. But it's definitely a priority to continue the state efforts. And again, that's where the lead advocate program is going to be really, really valuable. And having advocates that are active in the states, really grassroots mobilized and really taking the initiative to help move things forward is going to be essential. That's how we've passed every single law that's been passed, is with advocates on the ground, support from the Amputee Coalition, support from our strategic partners, and really helping to move things forward together. But we need folks like you to be able to help advance that beyond the 21 states that currently exist that have the law.
Okay. Is the Amputee Coalition pushing for states to open up enrollment for ACA healthcare markets in states that haven't chosen to do so right now?
So there are go ahead.
No, go ahead, Mary. That's okay. I'll follow.
We've been actively engaged with some of our coalition partners that are pushing to reopen the Affordable Care Act enrollment periods. There's a lot of context behind what's going on with all of that I'm sure Ray can give us a little bit more context on. But we have been looking at that with a number of our coalition organizations, including the National Health Council.
Great. And I would just add, you're absolutely right. This has become an issue that is obviously of unique interest to our community, but there is a huge echo chamber for this kind of access to a special enrollment period for the ACA exchanges in states that have not acted to do so, or states that frankly might want to do so at the state level, but are operating off of the federal exchange. So we should see this issue debated probably in a very vigorous way on the next legislative package as to whether or not Congress will impose on the administration a special enrollment period for those states that have not yet acted.
Okay, our next question is, where can I find information on insurance fairness? I feel like my insurance is not fair as many things are listed as not essential.
Honestly, the Amputee Coalition's website has a lot of great resources. We have, if you go to either insurancefairness.org, or if you go to the Amputee Coalition's main site and go to our advocacy section, we do have information available with all 50 states. We're going to make sure that all of that continues to be updated on a regular basis, but we've got a lot of great information there. And in addition to that, you can call our National Limb Loss Resource Center. The number on there is 888-267-5669. And it's a great resource. You can call them anytime. And if you've got access to care challenges that you're facing that you want more information about, or if you want information about some of the legislation or laws that exist in your state around insurance access to prosthetic devices, they can help provide some additional information and supports for you. And if you don't have a law in place right now, again, that's a great opportunity to be able to get more involved in some of these advocacy efforts in your state.
I just make one other plug, and that is if you're having a hard time getting access to the care that you need, especially in prosthetic care, we have a part of our website called Amplify Yourself that will help you reach out to the chief medical officers of the health insurance plans that you are enrolled in, to encourage them to look at your issue specifically and help you get access. Sorry, my mail just arrived. Help you get access to the devices and the incumbent care that you need to be able to either regain mobility, improve function, and we recognize that may be helpful to you as well. And we've had a pretty great track record of folks who do engage through Amplify Yourself who have had exceptions and appeals that are approved and access to devices.
Okay, our next question is, why aren't insurance companies keeping up with technology advances, such as repair of existing prosthetics and replacement options?
That's a great question. Oh, sorry.
I guess I would just say that as we look at our policy agenda and we look at the ways in which we can engage in advocacy at the federal level and at the state level, we also are building relationships with folks that may seem like strange bedfellows to you. So I always think that if you've got shared interest, that you should be able to sit down and have a conversation with someone. So we're looking at building relationships with some of the insurance companies so that we can have a better dialogue and provide to them the expertise and experience that we know to be true. I think there are some common and shared interests in creating pathways where improved technology is actually a great way of driving greater mobility and greater function that allows people to live their life in a productive way. It allows you to return to work if that's on the table for you. It allows you to be a part of your community in more sophisticated and helpful ways. It allows you to be on the sidelines at your kid's soccer game or your grandkids' soccer games. And we believe that there's real value in showing that access to technology and innovation allows people who in some rooms are called patients, and I'll say patients now, it allows patients to get back to a full life. And that there are economic realities and consequences that are actually better for both payers. That's what we call like the general insurance space, whether it's a Medicare coverage or private coverage. It helps in terms of the economics for both payers and patients and our society. So we're trying to make that case. We will be working with others to make sure that we're funding research to not only anecdotally show that to be true, but to prove that that's a reality. And we look forward to having productive dialogue with folks that I think historically we have felt a friction with. And I think that when we can see these things as being a shared interest and we can share knowledge and information to allow better outcomes for the whole community, let's still fight those fights on a one-on-one basis. But our job here is to also understand the universe of needs for the full community and then to kind of raise the entire level up and make sure that we actually get access to the things we need with the least amount of individual lift and effort.
All right, this is the last question for this session. I know we have a couple other questions on here that we will either answer in the next session or we'll just message you back directly with the answer. But our last question for this session says, if we are concerned with access to care, Is there a reason why we are not making an ask for support with HR 5262, the Medicare OMP Patient-Centered Care Act?
So yeah, that's a great question. That's actually a bill that was introduced by some of our strategic partners in the OMP profession. And we are generally supportive of many of the clauses within that legislation. One of the big clauses that has been a focus and a driver on the access to care and coverage. One of the big elements within that bill is the separation of prosthetics from durable medical equipment. And we really believe that that's something that will be valuable for the community. We believe that there are a lot of opportunities in that space. And so we are, generally supportive of some of the provisions within that act and that priority. But we are really trying to tailor some of the specific asks around some of the things that we focused and identified on in response to the COVID crisis and the needs for the community, really from that patient care perspective and that broader care continuum. And so we're really focused on making sure that access to care remains a top priority. There were a number of different pieces of legislation out there that have been introduced by the OMP profession, the other medical providers, the orthotists, the occupational therapists, the physical therapists, and other physician groups and wound care groups. And those are all pieces of legislation that we track and monitor and engage with our strategic partners at the right times and in appropriate ways. So it's definitely something that we are tracking and monitoring. We really support the separation from the durable medical equipment, but we've really tailored these asks to be specific and thoughtful given the current climate and also kind of where we're going with some of the access to care challenges that the community is facing.
That's great, Dan. Thank you. We have covered a lot. Mary, I want to turn this over to you for your final thoughts before we close out for this session.
Thank you, Carol, and thank you, Ray. We really appreciate, Ray, your expert view of Washington. And just in case it wasn't clear, we work with Ray and her partners at Tarplin, Downs & Young in Washington, D.C., both in terms of policy development and lobbying and engagement with the administration. So it's been great having Tarplin, Downs & Young as partners. And Ray, you were wonderful today, so thank you for being with us. Carol, thank you as always for walking us through the Q&As and navigating the chat. That will be archived and we'll make sure that we get back to folks. Dan, as always, did a great job, but I'm a little biased on that as I get to work with him every day. Let's just talk through where we are in the next session. So we did work through quite a lot today in this session. At 5 p.m. Eastern time, we'll talk about how to take all of this information that we've covered, and we'll talk you through how to use that information and tell your story in the most compelling way to get the attention of your members of Congress. And we'll make sure that we can connect the dots. And we look forward to seeing you tonight if you can join us. Thank you. I know we're a little bit over on time. I hope that you stuck with us. And we look forward to seeing you at 5 Eastern time for a great conversation to connect the dots and move forward.